Hello, my dear colleagues. This is Shane Lee from Branding and Communications Department, previously known as the Marcom. And for many of you, I believe this is the third time we've met online again, presenting to you the company profile, the latest version. This company profile was initiated in the year 2023, and every year we do this like a routine. We update it, and we add in some new exciting elements. So to begin with, let me briefly take you through the history of the previous versions. So starting from the version 1.0, this was like the fundamental, the very basic primary version of the company profile. But starting from that, we have been firmly sticking to the key message that is, Mindray is an innovative company, and we are a responsible company, and we are committed to the global market. So evolving into the version 2.0, which I personally like the most, especially the cover photo with this little girl representing Mindray's brand motto, better healthcare for all. And in this version, we started to introduce new ways of storytelling. Mostly, you can see that we add in many new video clips showcasing our reference sites. I remember before that, when we talk about the reference sites, we use mostly the photo of the hospital, we use the photo of the department, maybe some KOL, that's it. But in this version, you start to see that we are using video clips, giving you a sense of what's really happening in the customer side, how Mindray Innovation is actually helping the clinicians. So that's the major progress we've made in the version 2.0. And that's when we start to realize how important it is for Marcom, for the branding department, to collect the stories and to produce, reproduce this kind of stories and to help sales and marketing works. So in this version 2.0, we also have started to introduce some very innovative storytelling methods, like the Iron Man you see on the left side, where we use it to illustrate how AI is helping clinicians, like the super armor we provide to the medical world. And also on the right hand side, you can see the symphony, like this is a metaphor, how we compare the Mindray Innovation to the orchestra, helping the whole hospital to work in a very harmonic and effective way. And now, today, I'm very excited and very proud to introduce to you the version 3.0. I think, well, the company profile is one of my most important tasks. And today, I'm very excited and I'm thrilled to share with you some new concept of Mindray Innovation, which is the IntelliDigitalization. What's the Mindray thinking? What's the logic of our innovations? And also, I have prepared some new stories on the customer side. Like I just mentioned, we want to bring it to life. We want to show how Mindray Innovation is actually working and helping people. And also some new videos, some new stories, evidences I would like to share with you. So to start with, this version, you can see the difference, firstly, from the previous one is that we are becoming more rational. We are trying to deliver another message to the hospital that Mindray Innovation is here to help and to change your work for the better. Okay, I guess you're familiar with the Mindray history, but still it's important to mention that this year, 2026, we are celebrating the 35th anniversary of Mindray. So the important message we want to deliver to the customers is that how Mindray has evolved a long way from a patient monitor manufacturer to now a smart ecosystem provider. And then also you can see from our manufacturing side, Mindray has introduced the most modernized, also very highly automatic manufacturing facilities. And in this version, also the latest version, we have introduced some new data and methods to explain why Mindray has become a major leader, or one of the leaders in the medical technology world. So from this slide, I remember we have this slide in the previous version explaining how Mindray is one of the fastest growing medical technology companies, comparing with Philips, GE, Roche, and etc. So this slide, I won't spend too much time on it. And what you're looking at is the new slides I prepared for this version, showcasing Mindray's market value over the past 5 years. We understand that the market value is changing every day rapidly. So we determined to use the 5-year average data to show, from a long-term perspective, how Mindray is performing comparing with Johnson & Johnson, Roche, or Medtronic, etc. So you can see that Mindray is ranking, by market value, is ranking number 13, one of the top 20 companies. Our market value average market value is $58.3 billion US dollars, almost equal to the combination of GE Healthcare and Philips. And also, another important comparison is Mindray against other Chinese counterparts. We understand that in the recent years, United Imaging, Snipe, Coleman, and the other Chinese brands are very active. They have become a major headache for us in many overseas markets. So in this slide, we want to show to the customers by market value, by revenue, and also by the R&D investments, that from all these perspectives, Mindray is the absolute market leaders comparing with other Chinese companies. Mindray market value alone is actually bigger than the combination from number 2 to number 10, starting from United Imaging to the APT Medical, which also I would like to mention that APT Medical is also recently acquired by Mindray. It's now part of the Mindray group company as well. APT is specialized in the cardiac and vascular high value consumables. And today, Mindray is offering, like I mentioned before, the holistic solutions for the whole hospital. And for many of you, you are familiar with this slide, showcasing Mindray's market value by modalities. We have this slide in the showroom in headquarters, so I'm not going to elaborate. But still, it's important for us to let the customers who doesn't have the opportunity to visit headquarters yet, they need to understand how Mindray is performing, especially for patient monitors, anesthesias, and the ultrasound system. We're ranking the top 3 in the USA. These are the very important messages we want to emphasize here. Also, some data for Mindray's global branches and R&D centers. We are very ambitious. We are expanding globally. We are strengthening our commitment to the local markets. So in this slide, you can see Mindray's global footprint. Comparing with the developed brands or the other Chinese brands, I think one of Mindray's very unique character is that we are very ambitious. And every year you can see the change of our global footprints. Every year we are opening new offices, local offices. Even for some countries, for example, Brazil, Russia, India, Turkey, we have more than one local subsidiaries, and we're still expanding. That showcases Mindray's strong commitment to the customers and to the local markets. So that's a very important message here. In this slide, we'll mention about the R&D centers in the States, Datascope in New Jersey, Minnesota, and Zonari in Silicon Valley. And we have 2 R&D centers in Europe, and etc. So these are still very important message. So in this slide, I want to echo a very important message to the starting slide, which I compare Mindray's average growth rate in the past 15 years with the other well-developed big brands. So as we know, Mindray is one of the fastest growing companies, and that explains why we are so ambitious. That explains why we are so dynamic. And every year we keep launching new products, we keep launching new parameters, we keep changing and shaking the industry. So it's important to let the customers understand that the very strong and dynamic growth of Mindray actually supports, and this is a very important evidence, and it will build up the trust for customers to Mindray. So after local branches and R&D centers, this slide shows the localized manufacturing and production. Well, after the pandemic, actually we can feel it has become one of the top priority topics for many local governments. That's to strengthen the local manufacturing, especially for the medical technologies. So what we've witnessed in everywhere of the world, Saudi Arabia, Turkey, Egypt, Algeria, Singapore, Indonesia, Brazil, Mexico, everywhere local governments are asking Mindray to bring more products to the local market and to locally manufacture these products. So as a response to these trends, to these government requirements, now you can see Mindray is having a very matured, globally scattered manufacturing networks here. So service is another important topic for us. So everywhere I go, especially to the university hospitals, top hospitals worldwide, what customers, a typical response I get from the customers, a typical feedback from them is that, well, okay, bravo, I like your innovations, I like your products, but what I still don't have full confidence in Mindray is about your service, about your response time, about your local spare parts. So this slide is also a new element for this version. I'm not going every details of the data, as you can, we can prepare that in a memo. But in this slide, overall, we want to show, deliver this message is that we understand Mindray service today we're not perfect because business is growing so fast. And also a major difference between Mindray and other brands is that we don't use service as a very important revenue collector. So that means our service investment or our service infrastructure, the strategy is different from other brands. But what we want to show is that we are improving over time. For instance, there's this data here showcasing in the year 2025, the overseas inventory investment, we have increased 21% comparing with the past year. So that's a very important signal for us that Mindray service is trying to catch up with the business growth rate. And also another important message is that we are introducing the new tools, AI, MIoT, these new softwares, new tools will help us increase our efficiency in terms of the service. So another important topic for service is, of course, the simulation centers, the BME, department partnerships, and training facilities. So in Wuhan, in this slide, we are trying to show to you the latest inaugurated global training center in Wuhan. So next time, if you have the opportunity to invite customers to visit China, it's also a very nice choice to take them to Wuhan and to experience this very fancy, I would like to call it a very nice surprised global training center. And of course, other than Wuhan, we partner with other many top hospitals like the Ruijin Hospital in Shanghai, Albert Einstein Hospital in Brazil. So we partner with the top hospitals worldwide and to sponsor them to establish this simulation center for medical students. And of course, you're familiar with this information that Mindray is trusted by global top hospitals in United States, Europe, and China. Many of the data or the customer lists are still good. but we updated the latest ranking from the Newsweek magazine that amongst the world's best hospitals in 2025, 87 out of the top 100 general hospitals are Mindray customers, and 89 out of the top 100 cardiac and OBG hospitals are now Mindray customers. And if you still remember the previous figures, you can also get a strong sense that Mindray is growing and expanding our customer base. I remember like 2 years ago, we were only 57, 50, 60 something out of top 100. So this is also another important evidence how we are trusted by the global top hospitals. So in this slide, you can see also a new element we try to add in this new version of company profile is Mandray's relationship and recognition by the global governments, Ministry of Health. So in the past 2 to 3 years, there's a significant change we can feel in headquarters and worldwide is that Mindray, we are more frequently received by the Minister of Health, in some cases even the Prime Minister or the President. That also signifies Mandray's importance, our influence worldwide. So I believe for some regions, this kind of information is extremely important for you. So I encourage you to DIY your own version. And also along with the word map I used beforehand, I also encourage you to make your localized version. If you have extra local subsidiaries, if you have some very nice local manufacturing plants or already existing networks, please do emphasize that and make your own DIY version for your region. So now we talk about the innovations part. So this year you may feel this major difference other than the previous version is the new KV of our IntelliDigital solution. The branding department, branding and communications department, we together we produced this new KV, and some of you may have already seen this in the Dubai Expo, which is the first launch of this new KV and the new IntelliDigital concept. Well, we understand the reason why we use this new KV is we think IntelliDigital is rather a abstract and vague concept to the customers. So we want to bring more vibe, bring more the warmth, and something that really touches. So I encourage you to use this new KV in your exhibitions, in your marketing materials. So in this slide, I just want to take 1 minute to explain what you're seeing here. Also, in the following pages, you can also see some new elements. What you're seeing here is a static photo, but it's actually a motion picture. You can see along with the movements of these elements, we're trying to portray the data flows, the intelligence flow, and how Mindray IntelliDigital is bringing life to your current system. So to explain the fundamentals of the Mindray IntelliDigital solution, we start from the very fundamentals, which is the devices. Today, Mindray offers more than 300 model variants for the hospital-wide deployment. And these products are scattered into different major departments of the hospital, and together they start to create meaningful data. We try to collect these meaningful data, and based on these, we create this digital twin, the patient-centric clinical data. And for the next step, well, we all know that AI is the very hot topic everywhere. So based on these digital twin, based on these massive patient-centric clinical data, we start to train our AI models. And also Mindray is proud to announce that we are the first in the industry to have launched AI models for ICU, for operation rooms, for laboratories and also for ultrasound, and etc. So now I would like to explain how IntelliDigital solution is actually working and helping our customers worldwide. To start with, I would like to share with you the first, also the case that we are most proud of is the Shanghai Renji Hospital. So Shanghai Renji Hospital is the world's largest specialized center for pediatric liver transplant. And in the newly inaugurated building, there was a new building, as you see in the video, the white one, is specialized, dedicated for the pediatric liver transplant only. So this building, they have 250 surgical beds, 106 ICU beds, and 26 operating rooms. One of the highlights of the Renji, the new building solution, is that they have implemented fully implemented Mindray's IntelliDigital solution. Now I'm going to show you about 10 seconds the overview of this new building, how Mindray is helping equip this very modernized smart hospital. So one of the most important highlights of Renji Hospital is their command center. You can see on the right hand side of the slide, in this center you can access to all the patient's clinical data. You can access all the equipment data, and you can link to the 26 OR rooms real time for educational purpose, like this.
Even when 26 operating rooms are performing complex surgeries simultaneously, experts can oversee every procedure in real time via the smart demonstration screen utilizing 4K Ultra HD imaging. Every detail is captured and real-time feedback is provided to the surgeons.
So today, Renji Hospital has become the hottest destination for customer visit. And also for this year, for our international market, one of the most important tasks for us is to establish 15 Renji models worldwide. So needless to say, Renji is one of the most successful reference case for us. So Renji Hospital is very keen to introduce Mindray's latest technologies. For instance, our Qiyuan AI model for ICU, for anesthesia department, and hopefully for the laboratories in the near future. So according to the Renji Hospital, the Mindray Qiyuan AI models for the ICU are helping them to comprehend the patient's situation and to take necessary interventions 30 minutes ahead than the usual time. So following the Renji reference case, I'm also very proud to introduce to you a very unique offering Mindray has to the industry and also to the medical world is the Anasite. It's a very unique, small ecosystem that we created. Now we are connecting the patient monitors, anesthesias, and the PCI pumps. All together, we achieve the centralized viewings, centralized control for the pump, just like the video show you.
Anasite goes beyond just visualization. It puts control at your fingertips, allowing you to remotely adjust infusion pumps directly from your workstation, further improving your workflow.
So the video is very straightforward. I want to thank the EU PMLS team for creating this very short but very powerful video clip. This perfectly explains how the system works. So I also encourage other regions or also other product line teams, if you have this very high quality highlight videos, please do share with us so that we can use that to explain how cool our technology is. This is very important for us. Why Mindray Anasite is so unique and important is that Mindray, one brand, our company, we have the anesthesia machine, patient monitors, and the pumps. We understand, and I also see in ESICM in Dubai Expo, that especially for Jagger on their booth, they talk about the SDC a lot, the shared device connectivities. But they're using the Jagger anesthesia machines, Philips patient monitors, the B Brown pumps, or the Fresnels to connect these devices, but they will never achieve the height or the standard of connection, the level of connection we have. So still, this is very unique and important for us to do, tell the story and to deliver the message to the customers. Why the IntelliDigital, why Mindray solution is so unique is because we have created this unique ecosystem. So what's the value of this ecosystem? Why connect everything together? So this is a very perfect case to explain. So one of the very typical value of this NSI in application is that for the hybrid cardiac surgeries, usually we understand that the anesthesists, they will have to wear the lead aprons, the protective clothes from from radiations. Usually it's about 20 kilograms, very heavy. But now, since they can remotely control the pump and to remotely monitor patients' information, they can just sit more casually, or let's say more comfortably in the observation room. So this is a very unique value we can bring to the anesthesia doctors. So now we jump to the MWare story. First, let me finish playing this video for you.
MWare features modular design for complete wireless interconnection, allowing clinicians to pair MWare and patient information by quick PDA scanning. The system supports comprehensive vital sign and innovative health parameter monitoring to better evaluate patient status. For enhanced recovery patients, MWare ensures every movement is continuously monitored, using patented anti-motion algorithm to reduce interference. Once abnormal signs are detected, clinicians can receive alarms in real time through mobile viewers and respond in time. Safeguarding patients throughout the entire active, rest, and sleep phases. The system supports unified patient information viewing and management in the central station. Real-time warning of fall down or other unexpected accidents will be sent to clinicians for timely inspection and treatment. MWare can also expand the application to home hospital so that patient in late recovery stage can obtain medical-grade monitoring at home. The dedicated MWare app collect and send back the patient data to the central station in hospital for consistent patient monitoring and management.
In this version, you can see that MWare and TEAR have become more important topics for us. Why? Well, we know every day, actually, what we actually sell is the patient monitors or the anesthesias, the pumps, the regular products. Why wasting so much time to explain our MWare or the TEAR, the new generation products? It's because during my visit or during my past, 3 years contacting with the hospital presidents, directors, we found that these two products are most impressive for them, and they can best deliver Mindray's innovation leadership. So for MWare, in this version, we have prepared for you 3 news stories, how it's helping clinicians worldwide. The first one is a very unique value, or the most obvious one is that we address the clinical burnout issue for this Aarhus hospital in Norway. But first, let me explain what's their challenges. So before they have the MWare, we know that cognition burnout is a shared problem for particularly in Europe and in Northern Europe. So some of the high priority patients, they have to be accommodated in the corridor because they don't have enough nurses, they don't have enough manpower, so that they put the patients in the corridor so doctors can check on the patients anytime. So before they have MWare, they use the regular spot check. It's usually about 1 hour to 6 hours. Like I mentioned, also shortage of labor, manpower is the major challenges. So with the help of the MWare, we successfully help them to achieve continuous monitoring, also automatically collect the informations and to transfer the data, and also to trigger necessary alarms. So after they have the MWare, we have achieved the continuous monitoring. So every 2 minutes or every 1 minute, we collect the data and we can remotely update to the nurse's PDA. And even when patients fall down, we will trigger the falling alert. So the real-time alert will also send to the nurses via the CMS or the PDA system. So because of the continuous monitoring, because of the automatic data collection and transmission, we successfully helped the Aarhus Hospital to detect sepsis. For there's a real case, they detected sepsis in the patient 1 hour earlier than they would have done. So thanks to the news measurement. But behind this news measurement is our continuous data monitoring. And also now they have the continuous status. They can review the patient's status. They can have further, they can leverage the data. They can use the data much better than before. So that's one of the values that MWare has bring to the Aarhus Hospital. So the next case, I will talk about the Beijing Anzhen Hospital in China. It's the leading cardiovascular center in China, also one of the biggest. What MWare has helped Anzhen Hospital to do is we let patients move freely after the surgeries and ensuring their safety. And more importantly, we provide more data to support clinical decisions so that we can help the patients to rehab earlier and better. I'm going to show you a small video clip on this case.
MWare eliminates the constraints of traditional wired monitors, enables post-operative mobility, and monitors activity process. It reduces complications associated with prolonged bed rest and accelerates recovery. These patients' real-time electrocardiograms, pulse waveforms, and blood pressure readings are helpful for the physicians to provide medications and discharge instructions.
So in this video, you can see the 6-minute walking test. It's a very common tool and important tool. Is about home care. Actually, the question I get a lot from the hospital presidents, directors, is that after they see the video, they will ask, is it possible for home care? Is it possible that I can use a product and extend my service network? So we have bring it to life. In Netherlands, St. Antonius Hospital, they have established this center hospital in Utrecht, and they let 84 patients wearing the MWare in the remote areas, about 10 kilometers away, home care. So but every patient data is transferred to the central hospital, and keeping the patients safe and under monitoring. So this is only a test, but this is also a very important first step for us. Demonstrating Mindray MWare is, we're now opening a new chapter for home care and also for the future. So the next product, I would like to say the star product is the TE Air. I think in the last version, I have shared with you the same videos. So you have known about TE Air, and for some local offices, when Mr. Tsai or Kevin visit, we will ask the team to bring TE Air, to bring MWare, and to show customers so that they can do the live demos. And every time we do that, they just love it. It's a very, I would like to say, it's a very popular, it's a very nice, it's a very sexy product. Everybody loves it, as long as they have the chance to touch it, to use it. But what's more important, this time I'm bringing you some news stories, how TE Air is working, or how we are making, evolving along with the very sexy product. So the first case I would like to share with you is in Paris. It's called the SAMU de Paris. It's the third party, out of hospital, the emergency care providing organizations. They are also one of the world's first organization to carry out mobile ECMO. So how TE Air is helping them is that in this, we understand that in the ECMO workflow, is the most important thing is the rapid cannulation. That means to place the needles right in the patient's vein. So that's one of the most significant steps. So under the help of the TE Air, along with the VR glasses, we successfully help the doctors. We make the work easier, just like this.
One of the major complications, to be short, is the cannula are not in the artery and the vein, but the cannula is in the vein. And with the TE Air and the glasses, we can really show where we are. And I never move. More procedures are correctly done with the glasses, and that means we have more life saved.
So having this TE Air, the very powerful, compact, small product, the next step for Mindray is to create try to connect with the other systems and to create this more synergies. So this time we connect ultrasound with the patient monitors. As a result, you can see the hemodynamic assessments. Now we can use that along with the ultrasound image. So together now we have the qualitative and quantitative assessment. It's a huge improvement than before. So become another powerful tool for the ICUs. I'll show you how it works.
Touch and pair with AirSight dedicated Mindray main unit. Visualize real-time ultrasound images with unparalleled clarity. HemoSight now aligns ultrasound-derived parameters with vital signs for synchronized hemodynamic assessments, enabling confident and timely decision-making.
Also, having introduced the TE Air and the MWare, the portable, the concept of Mindray innovation, now we're trying to make all products more compact, more powerful, integrated. So that's a very important trend for our devices. And I think, judging from the global customers' feedback, it's been a very successful, it's been a proven successful approach, especially in the Paris Summer Olympics in 2024. They have used a lot of our compact portable devices for their emergency caring. I'm going to show you the video slide. So now we jump to the next topic, the emergency care. We talk about the Hamburg Fire Department in Germany. We know that Germany is having the world's leading network for emergency care. especially for data transferring, for their integrated workflow, their high efficiencies, especially in Hamburg. Although they are by volume, they're the second largest in Germany, but by their requirements or by demands, they are the leading, absolutely leading one in Germany. For instance, they have this very unique requirement that is the 8-minute response time. That's about 30% faster than the national average. And that means every time they receive the patient's alarms or the calls, they have to reach the patient within 8 minutes. And then all the data, all the necessary on-site caring and emergency caring should be done on-site and with all the data collected and transferred to the command center. So for Mindray, they have equipped with our latest generation of defibrillators DX because thanks to our integrated workflow, highly integrated, we have the patient monitors, defibrillators, ultrasound, and 12-lead ECGs, and we provide necessary on-site emergency carings, and also we collect the data. We fit in the data integration system, and now our solution is the perfect fit, and also where for the future, for the near future, we also will help the local fire department to achieve the let's say the integrated regional emergency care network. Okay, so the next reference case also for emergency care is in South Africa, the Netcare 911. We help the organization to establish a network covering the whole region. They have over 200 emergency vehicles. They have 5 helicopters and 6 jet air ambulances. So our solution perfectly fits these extreme conditions, for first aid. And also for command center, they have this huge command center collecting all the data necessary, patient data, and linking to the hospital emergency department. So this video will show you how our solution is helping.
It was nice to have not just myself, but someone with a screen or in the simulation center there to troubleshoot what's happening with the monitor with me in real time without having to disconnect or video call them or all these other third-party ways to try and explain to another practitioner that I need help so I can effectively monitor my patients. It's a high pressure environment, so knowing that you have a monitor that can relieve some of that pressure, on top of that, have a team who are not necessarily under pressure, but are seeing things in a calmer setting to help you in that high pressure area is the best thing that can happen for South Africa.
Okay, now we're back to our most familiar topic. That's the critical care ICU. Well, in this slide, I'm not showing you any top-notch or latest innovations, but what I'm trying to deliver the message here is that our solutions, especially for the centralized CMS, the connectivities solution is now widely accepted, recognized by top hospitals in UK, in France, in the United States, and etc. So this case shows Royal London Hospital how they're leveraging Mindray's connectivities to help them achieve paperless and high efficient nursing work.
The impact of device integration in Bath Health is that we now have immediate data capture of all our continuous monitors into our electronic record. Historically, we had a bedside chart that was only visible at the bedside. That was a number of monitors attached to pendants or walls and no ability to review the information outside of those areas.
We work in a massive unit with about 44 bed spaces. So if we have any concerns at that specific bed space, we can now relay it to the doctors via phone call and they can just look at the monitor right there and then. They wouldn't have to go to a certain bed space, investigate, ask what's going on.
So after the ICU, we move to the laboratory department. So this is another reference case in Kanghua Hospital in China. We know that especially in the past 2 years, Mandre IVD has experienced very, very high speed of growth. Now we are recognized by many large volume laboratories, not only in China, let's say also in Indonesia, in Romania, in Turkey, and etc. But we still don't have many reference stories, video clips yet. So Kanghua, as a first step, let me show you how we are now helping this level of hospital. It's one of the biggest private hospital in China, in southern China. How we are helping this hospital to increase their work efficiency and to save their man labors.
Our laboratory is the first private hospital laboratory in Dongguan to pass ISO 15189 accreditation. Up to now, we've passed it 7 times for 11 consecutive years. Our next-gen automatic analysis system integrates 6 platforms: hematology, HbA1c, coagulation, chemistry, immunoassay, and special proteins. We've achieved automation for the entire workflow, from sample pre-processing to testing and analysis, laying a solid foundation for building a smart laboratory.
So as you see in the video, we are helping, as the customers themselves, they mention smart laboratories. So the whole ecosystem Mandre has built, not only covering ICU, emergency care, but now we have moved to the laboratories as well. And also for another successful implementation in Indonesia is the Mayapada Hospital. Mayapada is one of the biggest private hospital chains in Indonesia, and they have 6 hospitals scattered in different areas of Indonesia. So one of their major challenge is how they can manage the quality control and also the training, reagent management, and to manage the differences between the different regions. So here's the Mandre's answer, the InnoLab solution for them.
After we using the InnoLab, it's more faster for the validation QC result, and also already become the faster to help the doctor from the diagnostic, and also reduce for the travel because before I need to travel to another hospital to check the QC.
Perubahan besar yang terjadi adalah pekerjaan jadi lebih mudah, mindahin lab, menghubungkan analyzer, meningkatkan produktivitas dengan report real time, mengurangi error, membantu meningkatkan training, dan meningkatkan performa TAT.
So for the IntelliDigital solution, another important implementation is the telemedicine. We call it the MicroPlus solutions. So where as an answer to cope with the common medical challenge, that is lack of experienced ultrasound doctors, Mandre leverages our MicroPlus solution. For instance, in this Seha virtual hospital in Saudi Arabia, let me explain how it works. They established the virtual hospital in Riyadh, the capital of Saudi Arabia. And the doctors, the senior ultrasound doctors, they will sit in this virtual hospital and they try to give advices, also to do the quality control to the primary care clinics in remote areas, like the one you just witnessed in the right-hand side at the bottom. So this is the idea how the MicroPlus works. I think you're familiar with this idea. I don't need to explain so much details. But now as a result, what I want to emphasize is that to date, Seha Virtual Hospital is now supporting 130 hospitals with more than 30 specialized healthcare services, and every year it's benefiting over 58,000 patients nationwide in Saudi Arabia. In the same case, it's also happening in Latam. We're bridging the last mile of maternal health. Maternity checkup is also another area requiring senior ultrasound physicians' advices. So this is the same case in Colombia, Antioquia province. I also prepared a news report on this MicroPlus reference case, but I think the principles or the theory behind is almost the same.
Puede empezar a transmitir la señal a partir de la necesidad que tenga el médico o la auxiliar de enfermería.
Para eso es muy importante y de hecho lo estamos viendo en pantalla a una persona que se le estaba haciendo una ecografía. En los televidentes se preguntarán, ¿es esto?
So the same idea also applies for Indonesia. We all know that Indonesia is a highly scattered island countries. They have over 17,000 islands. So it's important for us to introduce the MicroPlus technologies for them, for either quality control, for educations, to make healthcare more accessible across the nation. So the last topic, also another new element for this version is AI. I would like to say that I'm always amazed by the innovation of Mindray, how rapid, how dynamic we are. Actually, if you can see, ever since the launch of Qiyuan for critical care in December 14th, 2024, that means 1 year and a half ago, over the past 1 year, Mindray has launched 6 different Qiyuan models for perioperative care, for device management, for laboratories, ultrasound, and coming soon, we're about soon to launch emergency care AI model. And although now Qiyuan is mostly the Chinese version dedicated for mainland China use, but good news is that we're also trialing the Qiyuan models in Hong Kong, and hopefully we're also partnering with some local software partners in different regions. And we believe that AI will become a very unique advantage of Mindray, our unique offerings in the future. So it's important to understand how powerful the tool is. So let me explain how the AI works for in the Zhejiang First Affiliated Hospital in China. It's one of the top 3 hospitals in China. It's also one of the first customers to introduce Mindray's Qiyuan AI model. And we help them in their ICU to create the digital twin so that we give necessary advices and pre-analysis for to support clinical decisions. I will play the video for you.
Within this AI-powered critical care model, the patient's condition is categorized into several key modules. Data from networked medical devices creates a digital twin of the patient, integrating all parameters into organized dashboards. Does this require a highly experienced physician to operate? Not just any doctor. Only ICU specialists can handle this level of complexity.
We have also heard some positive feedback from the hospital, from Zhejiang First Affiliate Hospital. They have some real case, of course, unfortunate case, that about 6 months ago, there's a 15-year-old girl who fell down from a high floor and suffered from multiple internal bleedings. And it's important for doctors to evaluate what's the key metrics, what's the key steps they need to take immediately, because she's facing multiple bleedings and organ injuries. So Qiyuan, the advantage of Qiyuan is that we can analyze from massive data, and we give the advices, what's the key metrics, what's the key steps you need to take, and that successfully help the doctors to identify the most important actions. So that helps successfully save the girl's life. So something we're proud of, and something we believe what's AI becoming more and more capable of. So to sum up, today we talk about Mindray's IntelliDigital solution. We started from technological innovations. That's the standalone products, parameters. But the next step is the equipment integration, like the NSide I just mentioned, like the DX. Also, we have the M-Connect solutions for ICUs, laboratories, and etc. And for the future, it's not for the future, but the future that has partly arrived is the Qiyuan ecosystem. With the 4 steps together, Mindray is now having a very clear path for our innovation. Also a clear answer we have for the medical world. What we do, what's the value of Mindray, what's the smart ecosystem, what's the intelligent digital solution, what does that mean? That means let technologies do more, so clinicians can focus on what matters. Just like this slide shows, in the past, maybe 60% of time, or 50-60% of time, the clinicians suffered from administrative burdens, recording, handwriting. So clinician burnouts, manpower, lack of manpower, lack of lack of high quality care is the common challenge. So with the help of Mindre's intelligent digital solution, now with the help of Mindray, we can significantly decrease the administrative burden. We save time for them, for the nurses, for the doctors. So we give back their time so that they will attend patients. They have more time for direct patient care. They have more time for academic research. So that's the value. That's the answer of Mindray. And that's one of the most important message I want to deliver to you today. Also, the last part, let's talk about ESG. Since the previous versions, we have talked about the ESG ratings of Mindray, the Operation Smile. Those are, every time I talk about these stories, I can tell from the customer's face, they believe we're doing a good job. They believe we're doing the right thing. And every time I tell these stories, I think the atmosphere in the meeting room will change. Because before that, we talk about growth, we talk about business, we talk about innovations. But at the end of the day, that's the meaning of innovation. That's what we actually contribute for the real world is by our ESG actions. So in this year's new version, I have some updates for the Operation Smile. I have a news story for the Mercy ships and also a news story in Malawi. Here it goes. So the first story is the Mercy ships. I'll just jump to the videos so you can just enjoy.
95% of the countries in this area lack just the basic medical needs. The types of cases that we see are just amazingly complex. They don't have that access to care. They just progress in their lives and it just becomes more and more complex.
When the ships sail into port, you can see the people cheering because they know that they have hope. The hospital ships provide them the opportunity for health care, to provide them with surgery that they might not otherwise be able to get. Mercy Ships uses hospital ships to provide hope and healing to the world's forgotten poor.
We're confining an entire hospital onto 2 decks and we're trying to comprise and run a hospital. We are in this country where resources are difficult to find.
The environment changes all the time, and the team needs quick and flexible support.
They need to be reliable, effective, efficient, and interchangeable.
We have on board basically the same equipment as you find in a regular hospital in Europe or in the States. So our patients come in contact with Mindray equipment basically all along the journey they do on board.
So we can see the Mercy ship is actually, they have very nice facilities. They have very huge ships, and they're bringing the most advanced healthcare to Africa. And Mindray is proud to be part of this project. So for Operation Smile, this is a little update. I remember the last time we shared the story is Mindray just reached a 10-year deal with Operation Smile. The goal is to help 1 million pediatric patients that have the cleft lip and palate issues. So to date, the latest figure is that we successfully helped 320 patients, young patients, to have received necessary surgical treatment to make them to be able to smile again. So this is the video clip.
solamente su futuro, sino que también va a transformar eso.
So the last story is about is in Africa, Southern Africa, Malawi. We all know that from the United Nations, Malawi is recognized as one of the least developed countries in the world. And they suffered a lot from the major challenge for them is the HIV, TB, hepatitis, and etc. So what Mindray have done for Malawi is that over the past 10 years, we partner with this lighthouse organizations. Also, we donate the devices, and also we help them to do the free clinics, trainings. And as a result, we have successfully helped 250,000 Malawian patients in the past 10 years. And this is something we are proud of, and this is something we definitely will continue doing.
Ultrasound is one of the tests that is done on the bedside and that rapidly helps to diagnose, for example, TB. There is tests for cryptococcal meningitis, for TB.
With the elastography that is inbuilt in this new machine, now we can see how stiff the liver is, because that's also another marker of treatment eligibility, and that's how also Mindray is coming in to kind of boost that position that Lighthouse has as a center of excellence.
So here's the ending of the company profile. So we talk about Mindray's development, we talk about Mindray's innovations, our social responsibilities. But what we are really talking about, what we're trying to bring to the world, to our customers, is the new Mindray, is the brand, is the image of Mindray, one that becoming more mature, more confident. And year on year, when I take a look back in the company profile in the past 3 years, I actually feel proud, because every year we have new stuff to talk about, new technologies, new ESG initiatives, new investments, expansions. So we're still a very ambitious, we're a young, dynamic company, we're growing, we're changing. But the most important thing for us to do is to understand what's happening in Mindray and try to tell our stories to the customers. So we are all the ambassadors of the Mindray brand. So the reason why we're making this tool, why every year, year on year, this is one of my most important tasks. And the task that I feel most proud of is that I want to create a story for you. And let's just, let's learn it, let's know Mindray, and let's bring the brand, let's bring this dynamic brand to the world, and let our customers meet Mindray and know who we are. That's better healthcare for all. There's one more thing. For the appendix, we have prepared some extra slides for you, some regarding to our technology advancement. Also, one of my favorite slide is the orchestra. I try to keep it. Also, a very important thing is that I encourage you to DIY your regional version, to add in your local market insights, to add in your local customer demographics, and etc. So today, due to time limitation, I won't be able to elaborate more on the appendix. But if you have any questions, please contact the branding department, and it will be our honor to solve your problem. Thank you.